Hi there, Scott Moore, the AAA's HR and Operations Consultant. Thank you for joining me for another Workforce Committee Quick Take. This time, we're talking about the OSHA Emergency Temporary Standard. If you didn't get a chance, we did a full 1-hour program on this back on June 30th. And if you are a AAA member, you can log right into the member area of the website and you can watch the full program. In addition, there were two member advisories. The first right after the temporary standard was published, and then a second where OSHA had released a bunch of resources and other additional material that you can use as you comply with these new standards. Make no doubt about it, ambulance services are part of this and are required to cover this emergency temporary standard requirement. So as we talked about a bunch with the new administration back on January 21st, one day after entering office, President Biden signed an executive order essentially directing the Department of Labor to step up their efforts to protect workers in the workplace. And of course, protecting worker health, really what they said was, we want all employers to create a COVID prevention plan, right? In other words, an affirmative obligation on behalf of employers to go ahead and create a plan, look for those hazards related to COVID in the workplace, and then create a plan to address those hazards. Now, as you know, employers have an obligation under the General Duty Clause to create a workplace that is free from known hazards. Now, what we know about this latest emergency temporary standard, so this is an emergency rulemaking process, so there wasn't any notice and comment period. And I don't want to get too deep into the underlying, you can watch the webinar. But one of the things that this ETS requires is that you create a COVID prevention plan. This new standard took effect just a few days ago on July 6th, and employers had an obligation to comply with all of the temporary standards, emergency temporary standards on July 6th, with the exception of physical barriers, building ventilation, and training. The deadline for that is extended out to July 21st. So what's required? Of course, as I said, employers are required to create or to identify a COVID prevention plan coordinator, a safety coordinator. They're required to have a drafted COVID prevention plan, as well as a worksite and job analysis or risk assessment. But just so we're clear, I've been getting a lot of questions over the last few days about the differences and how this standard applies for people who are fully vaccinated versus people who are not vaccinated. So if your workplace, your EMS workplace, all of your employees are fully vaccinated, other than those potentially who have a protected medical condition or a religious exemption, and where all non-employees are screened for COVID and not permitted to enter the workplace, well, then those folks are exempt from some of the requirements, those requirements being the masking requirement, the physical distance requirement, and the physical barriers requirement, okay? If in fact your entire workplace all of your workforce is vaccinated. Now, you do have to have a policy to ensure that you can identify that people are in fact vaccinated. That is a requirement. Next, what about our unvaccinated staff? Because as I've asked around, and a lot of questions have come in the last few weeks, I've been learning that not as many of our EMS professionals are vaccinated as I would think there would be. But many of them are not, for a whole host of reasons. And as I always say, seek first to understand and then try and educate. But for those people whose workforce is not completely vaccinated, the question keeps coming up. Do they have to wear a mask if they're unvaccinated? And the answer is 100% yes. There are only a few exemptions or a few instances in which someone is exempt from wearing a mask. One, they are alone in a room. Two, they are eating or drinking and they are at least 6 feet apart, or there are physical barriers in between them. To the extent possible, they are already wearing an N95 mask or some other PPE. You are exempt from the masking when being able to view someone's mouth is important. So for example, for people who read lips, you are then exempt from that mask requirement. However, you still need to be 6 feet apart. You still need to have those physical barriers. When it's contraindicated because of an ADA protected medical condition, or where the use of masks presents a hazard. But where that occurs, you actually have to have an alternative. So there needs to be some mask alternative, whether it be a face shield, 6 feet apart, and physical barriers. Now, I have gotten a couple of questions. For example, well, what if people are in a bunk room? Well, if you have multiple people sleeping in a bunk room, believe it or not, that unvaccinated person must be masked. If they have their own sleeping bunk room and they are alone, they do not need to be wearing a mask. If they're alone in the garage, that's just a big room. If they're alone, they don't need to wear a mask. If they're working in an office with other employees with partitions, I got news for you. If they're unvaccinated and they're in an office with other employees, they are not alone and they must wear a mask. What if they're eating? Of course not. It would be impossible for them to eat through a mask, but you must have 6 feet of distance and barriers, provided it's possible. Now, if you're in an area where that's just physically not possible, you better have the barriers in place and you better have essentially show your good faith effort to comply with the emergency standards. What if you have a vaccinated partner in the driver's seat and an unvaccinated partner in the passenger seat? The unvaccinated partner absolutely 100% needs to be masked. Now, one of the questions I got this week were, well, geez, if you're requiring that I wear a mask, are you not disclosing my confidential medical decision, right? My decision not to be vaccinated. And the answer to that is, well, actually, there is no relationship necessarily between masking and vaccination. It is entirely possible that members of your workforce who are vaccinated still decide to wear a mask. So one doesn't necessarily equal the other. So you are not, as an employer, disclosing someone's vaccination status per se just because they're wearing a mask. And one of the other things that I get asked all the time was, what if the employee doesn't want it? And I say, OSHA doesn't care. What OSHA says is, even if an employee doesn't care about their own safety, we are still going to require that the employer provide the safe work environment. So it's not that I'm per saying in every instance that the employee who chooses not to get vaccinated is not caring about their safety. Of course they care about their safety. But what I'm suggesting to you is the employer's obligation to provide a safe work environment actually supersedes the employee's desire to wear a mask or not. So unless they have an ADA protected medical condition or a religious exemption in which you have to come up with an alternative, a reasonable as a reasonable accommodation. But outside of that, this mask requirement, no matter what your state masking guidelines are, as an employer, you have an obligation to abide by the emergency temporary standards. There's no question that OSHA wanted to encourage vaccination. And do I have any doubt that part of the reason they're saying that those who are not vaccinated must be masked or because they want people to get vaccinated? None whatsoever. I'm confident that that is what they are doing. However, in this instance, those folks who aren't vaccinated do need to be wearing a mask at all times that they're in the building, unless, of course, they meet one of these exceptions. Now, the idea of a quick take is that it's quick. So if you have any questions, you can send it in to info@ambulance.org. You certainly can reach out to me, Scott Moore at Moore EMS Consulting. But the AAA has plenty of resources available to members who run into these kind of things. This is what we're here for. So please reach out. And with that, I thank you.